Hi, I'm Lauren Barlew. I'm a women's health nurse practitioner and certified menopause practitioner. I work at Lotus Center for Women, which is a women's sexual medicine practice in Chattanooga. I'm here today to talk about perimenopause and menopause. Perimenopause and menopause are a time of our life when we're transitioning to out of childbearing years and can be kind of complicated as far as timing goes. Perimenopause is generally in our mid to late 40s is when that will happen, and the average age of menopause is 51. So that time before menopause is a time of irregularity with one's period, or a lot of times people will come in complaining of night sweats and some hot flashes, and then their periods will space out. A lot of times they'll get closer together or further apart, and sometimes they'll have trouble sleeping. And then menopause is defined by not having a period for a year, and so that can get a little complicated in telling someone exactly where they stand. But menopause, then after that, not having a period for a year, then those hot flashes, night sweats, and such things get quite a bit worse. So perimenopause, the first symptom that most people will talk about are night sweats. That is something that unfortunately really interrupts sleep quality. And generally they don't have daytime heat symptoms like in menopause, but the night sweats are pretty significant. And then that's when we get into people having periods that are irregular. And so someone's normal menstrual cycle, instead of it being on like monthly, sometimes it will shrink down to being every 20 days, or it will extend to being to over that 30-day range. And so those are two main symptoms of perimenopause. A lot of women will also complain of some mood changes and just not feeling quite like themselves. But from a physiological standpoint, those two symptoms are the biggest ones. The average age of perimenopause is pretty variable, so it's hard. It's actually pretty hard to define. So I look at it from the standpoint of those symptoms and their period regularity, and then we can do some lab work that will kind of help define that period. I generally will start looking at that in mid to late 40s for a perimenopause evaluation. And then the average age of menopause is 51 in the United States. That is a little easier to define. If we do lab work, then there's much more specific changes in the labs that we can see, but 51 is average. Yes, a person can get pregnant during perimenopause. That menstrual irregularity can be a little difficult to track as far as if someone is ovulating or not. And so it is very important that women have backup birth control. And we'll get into more kind of treatments for that, but absolutely someone can get pregnant during perimenopause. So during perimenopause, staying on birth control, regardless of the type, is very beneficial. A lot of my patients I do see, their husbands will have had a vasectomy, or they have an IUD that isn't due to be expired for a while. But yes, definitely staying on birth control is the way to go. Treatment options for perimenopause. A lot of people we will use birth control pills for because those do a really nice job of managing the night sweats and particularly helpful with managing the irregularity in the menstrual cycle. We will also often use IUDs. I'm a huge fan of IUDs for this time period because not only does the menstrual cycle change as far as its frequency, but also as we get closer to menopause, it isn't uncommon that someone's period gets a lot heavier, and an IUD does a fantastic job of preventing that. Yes, a woman or a girl is born with a certain number of eggs that she will go through during childbearing age, her childbearing years. And so, yes, at the end of perimenopause, which is then menopause, then you don't have any eggs left. So a person knows that they are menopausal um, technically by having no period for 1 year. So that is the definition of menopause. Now, there are, of course, a lot of symptoms that women will go through leading up to that. And so most women do not want to wait a full year to have that technical diagnosis because they're having a lot of those symptoms of like hot flashes, night sweats, um, irritability, brain fog, all the things. So if a person hasn't had any treatment moving, like getting up to that part, and they are, say, without a period for a year, then we can call that menopause. But leading up to that point, we don't tend to leave women without any treatment because they're pretty uncomfortable during that time frame. Treatment options for menopause are different than perimenopause. Birth control pills, the concentration of the type of estrogen, if they're estrogen containing birth control, are in a much higher concentration than hormone replacement. And from a safety standpoint, we don't want women on birth control pills typically if they are menopausal due to risks, increased risks of like clotting and such things. So we will often transition them if their desire is to be on hormone replacement to transition to hormone replacement, which is a less potent estrogen product for that age group. We had someone who is on estrogen who has their uterus has to also be on progesterone. It's very important to prevent the estrogen from stimulating the uterine lining too much and then can cause abnormal cells and abnormal bleeding within the uterus. So if you still have your uterus, if you've not had a hysterectomy, then you must be on progesterone. And this is another lovely place for an IUD to still be in place because we can generally rely on that to keep that lining from building up too much. So someone with on an estrogen product with an IUD is like a home run as far as hormone replacement. But also a lot of women will, even if they don't have a uterus, will also like to be on progesterone as well because it really helps with sleep, and insomnia, night sweats, and that kind of thing are a really difficult symptom to deal with during menopause. Menopause symptoms, hot flashes, night sweats, mood swings, irritability, and such things generally will last about 7 years. There are people that are definitely beyond that point. I have patients who we try to take off of their hormone replacement in their mid to late 60s, and they still have hot flashes and such things if we take them off. So the vast majority of people will be done about 7 years in. However, there are also non like heat symptom benefits of being on hormone replacement. So it just depends on the patient as to how long we continue that, if that's what they're wanting. And then the other thing to consider is that non-heat related symptoms, specifically vaginal changes, which we call genitourinary syndrome of menopause, GSM. Those usually show up about 5 years after menopause, and that's really important to stay on top of. And we do that with vaginal estrogen or vaginal testosterone. It can be very helpful for that. Staying on birth control after menopause, I recommend transitioning to traditional hormone replacement because of the potency of the estrogen used in most birth control, or really they use the same estrogen in all combined birth control pills. So the potency of that estrogen is just not considered to be the best practice to continue that. Now, there are some patients who just really love their birth control, and I'm willing to meet them with that, but eventually the plan would be to transition them to hormone replacement. perimenopause and menopause are a normal part of life. It depends on the person as to how much it affects their quality of life. There are plenty of women who go through this process and just as kind of like a blip on the radar, they just aren't that bothered by it. But there are a lot of women that go through, and this is a true change to their quality of life. It affects their relationships with their partners and their friends, or it can be quite difficult to go through. So I would just encourage anybody who is struggling to just go and talk to their provider, and it never hurts to do some labs and have a conversation and see what options are available to help them get through that transition. Women can experience perimenopause and menopause earlier than the average age. There are several reasons that someone might do that. Treatment for different medical conditions can induce menopause early. Of course, a hysterectomy, a total hysterectomy that removes the ovaries, can put somebody through menopause earlier. Or there are conditions like premature ovarian failure, issues with thyroid function. There's a lot of reasons that somebody could go through this phase of life earlier. So if someone is without, just suddenly stops having a period, or really is having a lot of those heat symptoms, then I would definitely look into that sooner. Don't wait until your mid-40s to talk to somebody about it. That needs to be evaluated quickly. Yeah, so vaginal bleeding after menopause is something that needs to be evaluated. So if we have just started somebody on hormone replacement, it isn't uncommon that they can bleed periodically as we're getting that dosage correct. But if someone has gone without a period for a year, we need to evaluate, and then they start bleeding, then we need to evaluate that. That is a situation in which they may have too much estrogen stimulation on the uterus, whether they are on hormone replacement or not, and that needs a medical evaluation.